Methotrexate is a medication used to treat severe psoriasis, rheumatoid arthritis, and juvenile rheumatoid arthritis when other treatments have not been effective. It belongs to a class of drugs called antimetabolites and works by suppressing the immune system. Using methotrexate as an early treatment for rheumatoid arthritis can help reduce joint damage and preserve joint function. The usual dosage for Otrexup Auto-Injector is once a week. It is best to take it at the same time each week to help you remember. Before we dive into the details of the Otrexup Auto-Injector, it's important to note that you should always read the patient information leaflet and instructions for use provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. If you're using this medication at home, it's crucial to learn all the preparation and usage instructions from your healthcare professional and the product package. Before using the product, visually inspect it for any particles or discoloration. If you notice either, do not use the liquid. The color of methotrexate should be yellow. Additionally, if the product has a broken seal, do not use it. The medication should be injected under the skin as directed by your doctor, typically once a week. After the injection, avoid rubbing the area. Prior to each dose, clean the injection site with rubbing alcohol and change the injection site each time to minimize injury under the skin. If you're unsure where to inject the medication, consult your doctor or pharmacist. Avoid injecting into skin that is red, swollen, bruised, or has scars/stretch marks. It's important to learn how to store and discard medical supplies safely. The dosage of Otrexup Auto-Injector is based on your medical condition and response to treatment. It's crucial to use this medication regularly to get the most benefit from it. To help you remember, use it on the same day each week. Do not increase your dose or use this drug more often or for longer than prescribed. Doing so will not improve your condition faster and will increase your risk of side effects. It may take several months before you experience the full benefit of this drug. If your condition does not improve or worsens, be sure to inform your doctor. Side effects of Otrexup Auto-Injector may include nausea, vomiting, stomach pain, drowsiness, or dizziness. Temporary hair loss may also occur, but normal hair growth should return after treatment has ended. Remember, this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, you should tell your doctor right away if you experience any of the following serious side effects: mouth sores, diarrhea, signs of anemia, signs of liver problems, easy bruising/bleeding, black stools, enlarged glands/lymph nodes, bone pain, unusual skin pain and discoloration, signs of kidney problems, dry cough, or muscle weakness. Seek medical help immediately if you experience irregular heartbeat, vision changes, weakness on one side of the body, severe headache, neck stiffness, mental/mood changes, or seizures. This medication may also lower your ability to fight infections, making you more susceptible to serious infections. If you notice any signs of infection, such as a sore throat that doesn't go away, fever, chills, or cough, inform your doctor right away. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, contact your doctor or pharmacist. Methotrexate, which is used in Otrexup Auto-Injector, is intended for the treatment of severe diseases caused by an overactive immune system, such as psoriasis and rheumatoid arthritis. However, it has been known to cause serious, sometimes fatal, side effects, including birth defects and death in unborn babies. Therefore, women must avoid becoming pregnant while using this medication, and pregnant women with psoriasis or rheumatoid arthritis must not use methotrexate. If you have kidney problems or excess body water, you must be closely monitored by your doctor as your dose may need to be adjusted or stopped. Additionally, methotrexate can rarely cause severe blood and bone marrow problems and stomach or intestinal disease when used at the same time as certain nonsteroidal anti-inflammatory drugs. It's important to discuss the safe use of these drugs with your doctor, as well as the potential for liver problems and other serious side effects that may occur during long-term use. It's crucial to be aware of the potential side effects and risks associated with methotrexate, such as lung problems, infections, skin reactions, diarrhea, and mouth sores, as well as the possibility of tumors or abnormal growths. If you experience any new lumps or growths, it's important to notify your doctor immediately. When methotrexate is used to treat tumors, it can cause side effects due to the rapid destruction of cancer cells, known as tumor lysis syndrome. This can be managed by drinking plenty of fluids and following your doctor's recommendations. Additionally, when used with radiation treatment, there may be an increased risk of tissue and bone damage. Overall, it's essential to discuss the benefits and potential risks of using Otrexup Auto-Injector with your doctor, and to follow their instructions closely to ensure safe and effective treatment. Before using Otrexup Auto-Injector, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to also inform your doctor or pharmacist about your medical history, especially if you have liver, kidney, or lung disease, alcohol use, suppressed immune system, blood cell or bone marrow disorders, certain stomach or intestinal diseases, or any active infections. Methotrexate, the active ingredient in Otrexup Auto-Injector, can increase your risk of getting infections or make current infections worse. It's important to avoid contact with anyone who has an infection that may easily spread, such as chickenpox, COVID-19, measles, or flu. Before receiving any immunizations or vaccinations, be sure to inform your healthcare professional that you are using methotrexate. It's also important to avoid contact with people who have recently received live vaccines, such as the flu vaccine inhaled through the nose. To lower the chance of getting cut, bruised, or injured, use caution with sharp objects and avoid activities such as contact sports. This medication may cause dizziness or drowsiness and may be intensified by alcohol or marijuana use. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Avoid alcoholic beverages and talk to your doctor if you are using marijuana. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that children may be more sensitive to the side effects of this drug, especially seizures. This medication may make you more sensitive to the sun, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you experience sunburn or skin blisters/redness, inform your doctor right away. Methotrexate can affect fertility in both males and females, so it's important to ask your doctor for more details. It's crucial to avoid using methotrexate during pregnancy, as it may harm an unborn baby. Your doctor should conduct a pregnancy test before you start this medication, and reliable forms of birth control should be discussed for women of childbearing age while using this medication and for a period after the last dose. Men with female partners of childbearing age should also discuss reliable forms of birth control while using this medication and for a period after the last dose. If you or your partner become pregnant, it's important to talk to your doctor right away about the risks and benefits of this medication. Methotrexate passes into breast milk and may harm a nursing infant, so breastfeeding is not recommended while using this medication and for at least 1 week after the last dose. It's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how Otrexup Auto-Injector works or increase the risk of serious side effects. Make sure to keep a list of all the medications and products you use and share it with your doctor and pharmacist. Don't make any changes to your medication dosage without consulting your doctor first. Some drugs that may interact with Otrexup Auto-Injector include acitretin, asparaginase, chloramphenicol, leflunomide, and others that can cause kidney or liver problems. It's also important to note that certain drugs that reduce stomach acid, such as esomeprazole, omeprazole, and pantoprazole, may increase the amount of methotrexate in your blood, leading to a higher risk of side effects. If you're taking any of these medications, speak to your healthcare provider for more information and to find ways to reduce the risk of side effects. If you or someone you know has overdosed on Otrexup Auto-Injector and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911. Alternatively, you can contact your local poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe nausea, vomiting, and bloody stools. It's crucial to act quickly in these situations to ensure proper medical care is received. It is important not to share Otrexup Auto-Injector with others. Before starting and while using this medication, you may need to undergo various lab and medical tests, such as complete blood cell counts, liver and kidney function tests, pregnancy test, and chest X-ray. It is crucial to keep all medical and lab appointments and consult your doctor for more detailed information. Remember, it's important to take each dose of Otrexup Auto-Injector as directed by your doctor. If you happen to miss a dose, make sure to speak with your doctor or pharmacist to schedule a new dose. Don't try to make up for a missed dose by taking extra medication. Stick to the prescribed dosage and follow your healthcare provider's instructions carefully. When storing Otrexup Auto-Injector, make sure to keep it at room temperature and away from light and moisture. It's important to also avoid storing it in the bathroom and to keep it out of reach of children and pets. When it comes to disposing of Otrexup Auto-Injector, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.